Thank you. So I just want to clarify that I'm not the one with all the solutions. It's the rest of the panelists here. But after 7 hours now of listening to all the problems, which we've all heard, I'm looking forward to hearing solutions. And I appreciate that the patient perspective was built into this meeting, and I'm allowed to talk to give that perspective. And I also appreciate that there's some other patient advocates in the room who've talked. I don't know about you, but I just have had a pit in my stomach listening to the conversation the whole time, because most of this isn't new. We've heard about it for a long time. But it's unsettling. It's unsettling because I feel like the patient is lost in all of this. We're talking at the policy level, and that's what we do. But at the heart of this is the patient. And imagine you're not in this world, and you're not a policy person, and you don't understand these things, and you're not in a physician or in the pharmaceutical industry, and you're diagnosed with cancer, and you really want your physician, you want the system to not have these barriers to getting the right care, and not have this buy and bill problem where your physician has incentives that aren't really what he or she may want or what you want in the decision making about what your care should be. And then there's these incentives that are causing shifts inside of care. And so where you go to get your care is affected by it. How much you're going to pay for it is affected by it. How much your cost sharing is affected by it. And all you think is, you're a teacher and you have good insurance and you have cancer now, and you think that, your insurance should cover these things and you should be in good shape. But you don't even realize all of the things that are really working against you in this system. And it's very frustrating and unsettling to me just to hear all of this, especially because it's not new. We've been talking about a lot of these things for a long time. And I don't have all the answers. I really hope that we'll get some from this group. I hope that we'll continue to have these discussions to get some answers. But I think that it's really important also that we do have to look beyond just the cost of drugs. I mean, we've heard that from a number of speakers. That's a piece of it. It's not the only piece of it. We need to look at the whole system and how it's incentivized and how we are treating patients and how we're paying for the care that is delivered. And are we paying for the care that patients really value? And when you're diagnosed with cancer, you want the care, you want that relationship with your physician and the care team. You want to be able to have a full and complete decision-making process to really understand all of your treatment options and make the best decision for you. You want that support that goes along with the care that supposedly is paid for by this drug margin, but maybe isn't, but really that manages your care all the way throughout so that you don't end up in the hospital because of side effects of your treatment, and that you have the best care possible, including palliative care all the way throughout your treatment from the beginning so that you're managing those symptoms and side effects. And our current reimbursement system really just doesn't incentivize that. And I know that there's a lot of experiments and a lot of discussion about bundling and different ways we could pay for care, but it has to really we have to look at the whole system and not just the price of drugs or the price of one aspect of care. We have to look at all of it to make sure that patients are really getting the best care, and that we're valuing what patients care about, which is the time they spend with their physician and their care team to really get the care that they need. We also have talked today about the communication with patients about cost. And I think that there's been some compelling cases made for why that's important, and I think patients really do, many patients want to have that discussion. I think it's important to ask the patient if that's what they want to talk about, though, because some patients don't. And that should be their prerogative if they don't want to have that conversation. If you're going to talk to me about my care, I want to know. I want to talk about costs. If you want to talk to me about what you're recommending for my 3-year-old to treat his cancer, I don't care. I want to just know what's the best treatment for him and not the cost. I'm not saying I don't care about the system as a whole, but I don't want to be factoring that into my decision. I want to decide based on what's the right treatment for him. So you have to really talk to your patient. Is this something you want to talk about? Is this something that will help you? I think patients sometimes will say no because they don't want to reveal their financial difficulties to their physician. So I think we have to think about, are there other ways of talking about the financial issues besides just with the physician? However, sometimes that comes too late. We learned in the example that Dr. Zafar gave that it wasn't until the patient said he didn't want to take this anymore, that he realized that this was a financial issue, or we learn about it when there's a non-adherence issue. So we do need to have better ways of talking with patients about this, and many patients really do want to be engaged on this issue. But I think we have to be careful to make sure that when we're asking physicians and patients to talk about this, that we're not putting the burden of solving the cost to society on that physician-patient interaction. Because it's a bigger question than that. We can't put all that burden on patients. We can't expect that by telling patients about the cost that they're gonna go advocate for lower costs. I think that's more of a role for patient advocates who are not necessarily currently in treatment, and the patient. It's too much to put on that patient. And we talked a little bit about the convenience issue, and that's really important to patients. I'm not saying that the dollar amounts that were discussed are worth the convenience, but what is the right number? Because when you're sick and you don't feel well and going to the doctor is a big ordeal, especially if you have to travel a long distance, convenience may make a difference. So I think we have to address these questions as a society. Where do we value convenience? And it may not be the same for every patient. That's why I think that patient-doctor decision-making, that shared decision-making is so important, because some patients, if you live close to the facility, if you appreciate the opportunity to get out of the house because you've been homebound and you're not working anymore and you want to get out, maybe that's okay with you. If it's really a burden, or you're still trying to work and taking time off from work to have multiple appointments is a big deal, that's a different situation. So I think that some of these value questions are not one size fits all. But I don't think that means that sometimes I feel like there's a belief that the value discussion is not one size fits all, so we don't need to address it. We do have to address it, but it's just not the same for every patient, and that decision has to be really take into account what the patient really values. I think I also appreciated what Gwendarian said about hope versus evidence. We did see there's a higher willingness to pay patients for hope, and there's some value in just trying, but I think we have to really think about how do we communicate the evidence to patients so that they understand it, and so that they really understand. It's probably not possible for them to really understand, but patients have the belief that words like response means that they're going to be cured, when that's not necessarily what you're intending to convey to the patient. So we want to make sure that we can give them hope, but make sure that they understand really what the possibilities are, the benefits and risks of every treatment, and then the financial costs are a part of that if that's what they want to discuss. So I didn't have slides today because I really wanted to react to a lot of what I heard today, and I really did feel unsettled by a lot of it, and I hope that we can come to some solutions, but I just wanted to touch on a few of the things that I felt were important and that I've heard from other patient advocates and I believe are important to patients. Thanks.
Thanks so much. Our next speaker is Mark Fendrick. He needs no introduction, but I'll introduce him anyway. He's a professor at the University of Michigan Center for Value-Based Insurance Design. Probably nobody in the country knows more about that than this man.